Hey everybody, so today I'm going to be talking about eating disorders in collegiate male athletes. And for my PICO question, I'm going to be comparing treatment options when looking at cognitive behavioral therapy and physical exercise and dietary therapy. And this is interesting to me because the prevalence rate is pretty low in males, or it's just not talked about as much. But I just want to bring awareness to the fact that eating disorders do occur in males and they do happen in particular sports. So, just a little background information. As I said, the prevalence of eating disorders varies. In males, it is anywhere from 0 to 19% in male athletes, and then it can go up to 45% in female athletes. A common eating disorder is bulimia nervosa, and the people with bulimia typically judge their self-worth exclusively by their weight and their shape. Some symptoms of bulimia may include dietary restraint, excessive exercise, purging behaviors, and this is usually stemmed from their attempt to control their weight and shape. So, for the evidence that I found, athletes who self-weighed 7 times per week reported the most pressure to lose weight and be lean and muscular. They engaged more often in muscle-building behaviors, they dieted most often, and they had the highest level of bulimic symptoms. And comparing athletes on these teams that conduct the mandatory weigh-ins versus not conducting, they definitely had more dietary restrictions. So weighing in particular, when it's voluntary, may contribute to an over-concern with appearance, body shape, and size, and then this can lead to a variety of behaviors related to eating and body change. And nearly 1/4 of athletes showed disordered eating behaviors, which was associated with body image dissatisfaction. And athletes with higher body fat dissatisfaction had a higher body fat percentage. And there wasn't really any differences between competitive and non-competitive athletes. However, the more common sports that these symptoms are found in are baseball players, cyclists, wrestlers, and rowers, which I thought was really interesting. And then for runners, one study looked at compulsive eating behaviors and compared it to weight suppression. And for male runners, the association between compulsive eating and eating pathology were stronger if they had an elevated weight suppression. And then for the treatment, they suggest to look at weight suppression as a critical factor when you're looking to treat your athlete. So for treatment, as I said, I'm looking at cognitive behavioral therapy, which looks at talking about your thoughts, the actions that you're doing, and how it relates to your feelings. It's like a cycle, and comparing it to physical exercise and dietary therapy. They're both treatments for bulimia and other binge eating disorders. And cognitive behavior therapy includes, as I said, exposure therapy. So you're confronted with your fears, and there's like a stimuli involved to try to prevent these behaviors from happening. And then there's been more evidence to suggest that cognitive behavior therapy works for adults and older adolescents with these eating disorders. But both treatments focus on normalizing eating patterns, correcting basic self-regulatory processes, and reducing these aesthetic evaluations of self-worth. And they've both been found to be effective, but it depends on the availability of the professionals that you have at your fingertips. So, in conclusion, among male athletes, it's important to examine the concept of muscle dysmorphia as a possible eating disorder, and as they see themselves. It's just important to be aware of how they're feeling. And then there's just an overall need for an increased openness and awareness about eating disorders in male athletes in particular, but all athletes. And coaches and athletic trainers need to accept the seriousness of this and have competence in the treatment of these conditions, be able to identify them, treat them, and prevent them from happening regardless of age and gender. And so, again, I would conclude that cognitive behavioral therapy may be the best treatment option for these athletes. And those are my references.